Welcome to this edition of the First Aid Show. In this edition we're just going to have a look at severe blood loss. So we're looking at something which could cause an excessive amount of blood to be lost from the body. Excessive blood loss does not just happen when the skin's broken. A bone can be fractured and the blood can be lost inside the body. For example, if a thigh bone is broken and the skin is not broken, you can lose half to 1 litre of blood. If the skin is broken and there is a bleed, this can be increased to 1 to 2 litres. Fractures in the pelvis can cause from minor blood loss of about half a litre to major injuries where you can lose all of the blood. The main femoral artery runs over the pelvis, which is a major artery. Injuries to the spleen, liver or chest can cause very minimal blood loss to total blood loss. The big problem is recognising that severe blood loss is actually possible or is actually happening. It's best to assume the worst and treat as if there is a severe blood loss. It's very hard to work out how much blood has been lost with an external bleed, and even harder if it's an internal bleed. It's also difficult to assess blood loss as different people will react in different ways, which can cover up the signs and symptoms until it gets very serious. Things can affect the way that the signs and symptoms show. Things like age, size, weight, underlying medical conditions, their fitness, and any medications they're taking. You need to get as much information as possible about the history of what's happened and the mechanism of injury. Things to look out for are pale, cold and sweaty skin, breathing rates of over 9 breaths per minute, thirst, pulse of over 100 beats a minute, altered mental state, anxious, confused, drowsy, restless, and finally unconsciousness. The treatment is to first activate the emergency services, treat external bleeding and try to identify if there is internal bleeding. Lay them down and elevate their legs if possible. Finally, keep them warm and monitor their consciousness and vital signs.